Hello, and thank you for joining me again today on the Finding Hope After Loss podcast. What happens when you're going through a miscarriage, a stillbirth, or any kind of pregnancy loss, and the people that you turn to for help just dismiss you? Today, I'm joined by Goldie, who shares her experience of recurrent miscarriage, a second trimester loss, and navigating pregnancy after loss while raising her living children. In this conversation, we talk about what it feels like to be dismissed by medical providers, the shame and silence that can follow repeated loss, and the emotional weight of making decisions like a D&E in the second trimester. Goldie also shares what it's like to carry grief that others don't always see, especially when the outside world only sees your children, not the pregnancies and the babies that you've lost. Hello, everyone. Today I am here with Goldie. Goldie, can you tell us a little about yourself?
Sure. My name's Goldie. My husband and I live in St. Clairsville, Ohio, which is about an hour south of the Pittsburgh area. We have three kids. Delaney is our oldest and she's 6. Killian is our middle and he's 3. Tegan is our newest addition and she's now 10 weeks. I'm currently on maternity leave, but I work in IT as a senior project manager, and my husband is a nurse practitioner. And we also have a golden retriever named Piper.
You have to have the dog, right?
Well, I have to mention her because she ate a corn cob a few days ago. So she just got out of the emergency vet and it's been like a
Oh,
whole thing, but she's
oh
fine.
my gosh.
Yeah,
They just like to scare us and do
they
things that
do.
they shouldn't do and cause chaos.
Yep.
But like you can't be, you can be mad, but you still love them.
Yeah, I was definitely annoyed. I was like, why'd you have to do this?
I know. So do you mind sharing a little about your lost journey?
Sure. So I'll be sharing 3 lost stories today. They do span over a period of 4 years and they happened in between healthy pregnancies. So I'll be touching on those to give some background. So I got pregnant with my oldest daughter, Delaney, in late 2018. I had an uncomplicated pregnancy and birth, got pregnant very quickly. When Delaney was about to turn 2, we decided it was time to start trying for another baby. My husband and I had always agreed we wanted more than one child. I always wanted 3, he always wanted 2. Obviously, we know who won that that debate. It took a few cycles, but I still got pregnant pretty quickly. I remember taking a pregnancy test in the middle of the workday because I was working from home since it was still during COVID. This would have been like August of 21. The line was fairly light, which did concern me a little. I remember with my daughter, like it was a very obvious positive. I didn't have to like hold the test up to the light and try to squint. So I was a little concerned, but I was still really excited. My husband was working night shift at the time. So I told him first thing the next morning when he got home from work that we were going to have another baby. My friend was coming over that day to swim, so I couldn't wait to tell her because she was also pregnant and our babies were going to be like a month apart. I texted my photographer friend and asked if she could take some pictures so we, could get pictures of Delaney wearing a big sister shirt. We drove about an hour and a half to West Virginia to see my parents' in-laws to surprise them about the pregnancy. We showed them the pictures that we got of Delaney wearing the big sister shirt. Everyone was excited, but I don't think anyone was that surprised since they all knew we were planning on having another baby. On Sunday night, we drove home. I went to the bathroom and I saw blood. It wasn't just spotting, it was actual like bright red bleeding. Told my husband I was going to lay down for a bit. It was about 7:30 that night. I just had assumed I had done too much because I was chasing Delaney around all weekend and doing a lot of visiting. I didn't see any blood for several more days, so I thought everything was fine. That Thursday night, I was texting my friend that was also pregnant. I just kind of mentioned how I noticed some bleeding several days before, but hadn't seen anything since then. No joke, within minutes, I went to the bathroom and the blood was back. So this time I started to get concerned. I didn't really know a lot about miscarriage, and I knew that some women had bleeding during pregnancy. So I was trying to keep myself somewhat calm. Told my husband I would just call the OB in the morning. The PA at my OB's office happened to answer because she was doing paperwork. Apparently, the office was actually closed on Fridays. She told me I needed to go to the ER to get the RhoGAM shot because I have negative blood type. My husband was off work, so we drove to the ER. On the way there, I was thinking I would just get the shot and everything was probably fine. First thing they did in the ER was take me back for an ultrasound. I'll never forget the ultrasound technician asking me multiple times, "Are you sure your last period was July 21st? Are you sure you got a positive pregnancy test?" I was like, "Yes." Like I used ovulation tracking. Like I know exactly when my last period was. And, by that point, I had had several positive pregnancy tests, like where it said pregnant. It wasn't just me kind of squinting at the line anymore. So, like, I was sure I was pregnant. I left that ultrasound not feeling good about things at all. I was sitting in the wheelchair waiting to go back to my room when my HCG results came in on my phone. I didn't know much about HCG because I had never had a blood draw for that with my daughter. But when I saw 1200, I knew that was really low just based on reading forums I was on. I should have been almost 7 weeks at that point. So the ER doctor came in and he told me they were concerned I was having an ectopic pregnancy. I was really confused because I wasn't in any pain. He basically told me because the number was so low and they couldn't identify anything on the ultrasound except a corpus luteum cyst that they couldn't rule ectopic pregnancy out. Unfortunately, this was the Friday before Labor Day. I couldn't even get into my OB until Tuesday. The ER doctor told me to try to find something to do over the weekend and try not to worry. I'm thinking like, yeah, okay, I'm not going to worry, right? You just told me I may be having an ectopic pregnancy and I'm just supposed to, go home and have a good weekend.
I know they're trying to be like, I don't know, helpful or like
Yeah,
reassuring, but it is absolutely not at all.
no. I did have plans to take Delaney to a pumpkin patch with some friends. So I was trying to do something to pass the time at least. And of course, my husband was working night shift that entire weekend. So I called my parents and I had them drive up because I'm thinking if I'm having an ectopic pregnancy, I don't want to be home alone with my toddler. So Tuesday finally got here. I called my OB's office, and of course, they had no idea I was in the ER. I had to explain to them multiple times what was going on and why I needed to be seen. They finally told me to come in for an ultrasound at the OB lab. The ultrasound technician was really quiet and then said, "You need to see your OB, something is wrong." I went straight to my OB's office. He said he didn't think it was ectopic. He said it was likely a miscarriage or a very early pregnancy. I kept telling him, once again, I knew when I ovulated. Like I knew by this point we should have seen something if this was, a viable pregnancy. He told me to wait for the HCG numbers to come back and sent me on my way. I took Delaney to her tumbling class and I saw the HCG number come in on my phone. It had only went up by like 12 points. And by this point, it had been like 48 hours since the first draw was done. So I knew that wasn't good. My OB then called me on the way home. He told me he thought I was right and I was having a miscarriage. He kind of went over some options with me, but ultimately I decided just to kind of wait it out at home because the HCG was already low and I was already bleeding. So to summarize, I was able to get through that at home. I think I bled for maybe like 3 weeks, and I did not need a DNC. I had weekly HCG draws until the number was about back down to zero. And then the PA from the OB's office called me to tell me that I could start trying after I had one cycle. And even though it wasn't so physical, it was really emotional because I had already told so many people, right? Like I didn't follow the 12-week rule of waiting. Like I was so excited to tell my friends and my family, and to have to go back and text all these people like, "Oh, hey, I'm actually having a miscarriage," was terrible. I had to take time off work. So it was more emotional for me than physical. And in my head, I had this perfect age gap planned. Like, Delaney was going to be two years and 9 months older than her sibling, and it just seemed so perfect. And to have everything taken away like that, it was hard.
Yeah, I mean, I think a lot of people don't understand like a miscarriage is not just a quick, you just bleed and then it's
Right.
done. Like it has all these lasting effects that so many people don't think about, even if it was physically, and I'm putting this in quotes, physically easy
Right.
on your body.
Yeah. Yeah, for sure. So, since I had heard that my HCG was back down to zero, my husband and I decided we would try again. I got a positive pregnancy test right around Halloween 2021. This time, my husband and I both agreed we would keep this to ourselves and not tell hardly anyone, just based on what had happened. I think I told two friends. That was it. I didn't tell my parents. I didn't tell anybody. I found out right at about 4 weeks, and everything seemed to be going okay. However, by the middle of November, I started to notice some brown spotting. This was spotting and not bright red bleeding like I had the first time. So I thought, okay, maybe everything's still okay. I was out of town at my parents' house for an entire week and I still hadn't told them. I just waited it out and assumed it was probably okay. And I just thought I'll call my OB once I get back home. So I did that. I called my OB's office, and the receptionist I talked to, she was really dismissive. It was basically like, well, if you're having a miscarriage, we can't do anything for you anyway. I mean, it's like, okay.
Like, wow, way
So,
to be sensitive.
yeah. So she told me just, wait till your 8 week appointment and we'll go from there. Well, a few days later, it wasn't just brown spotting. It was like, full on red bleeding again. So I knew what that meant. And it was in the middle of my workday. Of course, all of this happens at like, the worst possible time.
Yeah.
So I had to tell work like I was having an emergency. My husband and I went to the hospital again so I could get the ROGAM shot. Same workup was done where they did the ultrasound and the HCG draw. This time, the ultrasound technician didn't keep asking me if I had a positive pregnancy test, so I thought that was good news. The HCG number came in first. It was around 1800. I knew that was still low, but it was better than it was before. And then I saw the ultrasound report and it said there was cardiac activity. The heart rate was 108. However, I was measuring a full week behind at 5 weeks and 6 days instead of 6 weeks and 5 days. The doc came in and told us that I was likely having a threatened miscarriage where there was a heartbeat, but the HCG was really, really low for almost 7 weeks. He told me it could go either way and to follow up with my OB. So I left feeling optimistic, but I definitely had doubts that this would actually be viable. And then the PA from my OB's office called me and said I needed to get my HCG checked again. She basically was like, I don't even know how they saw anything on that ultrasound with the HCG being that low. So, of course, that made me feel terrible.
She has terrible bedside
Oh, it
manner.
gets worse. It gets worse. Just wait. It gets worse. So I got the HCG checked and the results came in when I was on a meeting with my boss. I could hardly finish the meeting when I saw the results. The HCG had went up, but only by like 100 points. Since my boss knew I had just had a miscarriage 2 months prior, I was embarrassed to say anything. So I just kept working throughout the day, even though I knew that I was definitely having another miscarriage. My parents were coming up the next day to take Delaney to see Coco Melon. There was like a Coco Melon show that was coming to town. They still didn't know I was pregnant. I just felt the shame like surrounding this whole scenario that I was losing another pregnancy so close together. So I still didn't tell them. We took Delaney to the show and I was starting to bleed pretty heavy at that point. And by evening time, the bleeding was really bad. My husband had finished up his shift at the hospital like around 7 or 8 p.m. that night. And when he came home, I basically was like, you need to go downstairs and visit with my parents. I'm going to lock myself in the bathroom. So that happened. And, I think everything happened pretty quickly that time, like with the bleeding, but it was rough. Like it was definitely probably one of the worst nights I've ever had. So I called my OB on Monday to tell them that I was for sure miscarrying and I would like to have another appointment to see if any testing could be done since I was having back-to-back miscarriages. I got stuck talking to the PA again, and she came on the phone and told me it was my fault that I was having another miscarriage because I had the pregnancies too close together.
What?
And I
What?
said, yeah, and I said you called to tell me that my HCG was low enough and I could start trying again.
I mean, you're here already feeling guilty because of your own feelings and feeling alone in this, and then she just goes and piles it on, making it seem like you did something wrong, which you didn't.
Right. Yeah, it was horrible. And then she was like, well, if you need a DNC, we're all booked up, so you're gonna have to wait till after Thanksgiving.
But
I'm thinking like, really?
like really, there's no room. You're just gonna that oh, I don't even have words for that. She's terrible.
Yeah. Yeah, so my OB did agree to see me at the end of November, and I really pushed for testing. I was like, listen, this has happened twice in a row, like back to back. Can we do any testing? And his response was, well, you need to have 3 miscarriages before we do any testing. And then he said it was bad luck. Like the miscarriages had happened because I was having bad luck.
So
So,
two in a row is just bad
you
luck.
know,
No need to dig further.
Right. It's just, I mean, that was the easy answer. Like, I was 30, so my age wasn't an issue. I was in really good shape. Like, I've been a tennis player most of my life. Like, I was running frequently. So, like, there was nothing obvious as to what had caused them. And he didn't, want to do any additional testing. So that was the answer I got. You're having bad luck.
I
And
mean, that I'm sure. How did you feel about that?
I felt terrible. I told my husband, I was like, what is going on? And, my husband's in the medical field, obviously not specifically like anything related to pregnancy. And he agreed, like, that's horrible bedside manner. Like the whole thing, like he agreed that I basically had slipped through the cracks because I was young enough and healthy enough to not have any apparent issues. I did ask OB if he could at least test my thyroid because I had done some reading online. I was like, well, maybe something's up with that. He agreed to do that, and the test came back fine. So, I left that appointment. I had no answers why this had happened, and OB said, go ahead and try again.
As if
So,
that's not terrifying.
yeah, right. And I told my husband, I was like, we should probably wait until at least the year is over, considering how terrible the year has been for us. And we had planned to do that, but it didn't actually happen. I got a positive pregnancy test in mid-January of 2022, and the pregnancy was viable. And the crazy thing is, I was really sick. Like, Delaney was in daycare at that point, so she was bringing home all sorts of illnesses. I remember I got norovirus, I got COVID twice, I got COVID at 9 weeks, and then again at 39 weeks.
Oh
And
my
then I
gosh.
was on my way to pick up Delaney from daycare, and I got into a really bad car wreck. Like, I got hit head on by somebody, and I was only 6 weeks by then. And despite all this, my son Killian is fine. Totally healthy pregnancy. Like, I did nothing different. I had all these things happen to me. Of course, my anxiety was through the roof. Like, every time I
Yeah.
went to the bathroom, it was like, okay, am I bleeding? Like, what's going on? And I also asked to have HCG draws, and I was told no. Like, the office wouldn't do it. So this whole time, especially early on in the pregnancy, I'm like, okay, is this even going to be a viable pregnancy? But yeah, to summarize, it was. And, now we have Killian and he's 3, and pregnancy was fine and the birth was fine. But it's crazy. Like, the lack of compassion and proper bedside manner I received up until this point was terrible.
Did you ever think about switching doctors?
I did think about it, but the problem is, like, we live in a small town. I mean, there just aren't that many options. Like, I would have liked to have gone to Pittsburgh or somewhere else, but that's still over an hour away. So
Yeah, that's a lot harder to do when you're in a small town.
yeah, so I just kind of just decided to stick with it, and go from there.
I mean, I'm sure at that point you thought, well, surely it can't get worse than what they've already said, right?
Right. Yeah.
Not that that's any comfort, but
Yeah. Yeah. Well, once Killian turned 2, we weren't using any protection, we weren't preventing, but we also weren't trying. In October of 2024, I got a positive pregnancy test. I shouldn't have been that surprised, but I wasn't tracking ovulation, so it did kind of catch me off guard. I had some brown spotting, so I wasn't really sure what was going on, but then I got the positive pregnancy test. I scheduled an elective ultrasound right at 6 weeks because I didn't want to wait until I could get into my OB. The ultrasound technician said everything looked great. The heartbeat was good, and I was measuring right on track. So I go home, I went to the bathroom, and there was bright red blood. So, given my history, I knew I should go to the ER and get the ROGAM shot. My parents were coming up that day to visit. We hadn't told them I was pregnant yet. They walked in the door, and I was like, oh, by the way, I'm pregnant. I'm bleeding. I need to get to the ER now, and I'm going to need you to watch the kids. So that's how they found out. So my husband and I went to the ER. The HCG came back first, and it was around 18,000. Figured that was a good sign considering how low my HCG had been with the other miscarriages. I then got the ultrasound report. They had identified a small subchorionic hematoma that was causing the bleeding. They told me the pregnancy looked fine and to follow up with my OB. By this point, the previous OB had retired, so I was going to the OB that replaced him. She wasn't concerned about it. She didn't want to see me before 8 weeks. By the time I saw her at around 8 weeks, the hematoma had already resolved, and she said everything looked great. I decided this time that I would like to do the sneak peek clinical, where you go to an office and get blood drawn to find out the sex of the baby. This was right before Thanksgiving 2024. I got the results through email. I shared them with my husband when it was just the two of us at dinner before we had our gender reveal with our families. The email said I was having a boy. We were both really excited. I didn't care really either way, but I knew my husband would be super excited. We did a cute gender reveal that was Thanksgiving themed with our families. At that point, everyone knew I was pregnant and I was having a boy. I texted a bunch of friends on Thanksgiving with the gender reveal pics, and everyone was happy for us. I then had my 12-week scan in early December. OB said everything looked great. She let me see the baby, and I saw him doing flips and being super active. My husband couldn't make the appointment because he was at work, but I told him how well everything went. By this point, we were both starting to get really excited. I announced the pregnancy on social media later that month. I told work. Work already had me reviewing resumes to find my temporary replacement because I was going to be having a long maternity leave. We had already started redesigning the upstairs of our house so we could fit in another nursery. So, it seemed like the pregnancy was progressing well, and whatever bleeding I had was caused by the hematoma, and that had resolved, and we were preparing. But then our entire world came crashing down. I was working from home on December 13th. I had this idea that I would like to schedule an elective ultrasound to confirm the gender. Not that I thought the sneak peek clinical was wrong, but because I thought it would be fun to involve our other two kids in this to get them excited. I found a place in the Pittsburgh area that had an opening for the next day, Saturday, December 14th. The next morning, I woke up knowing that we had the ultrasound appointment. I was super tired. I laid down to take a nap, and I could barely get myself up from the nap to go to the ultrasound appointment. And that wasn't like me. This pregnancy, I actually probably had the most energy and felt really good the whole time. So for me to not even want to get up, it was really strange. But I got myself out of bed. We loaded the car and we drove the 1 hour to the ultrasound appointment. It appeared to be in an old hospital building, so it felt very sterile. I didn't like the vibe as soon as I walked in the doors. We finally found what office we needed to go to. It was the smallest ultrasound lobby I'd ever been in, and by that point, I had been in a lot of elective ultrasound places. The technician wasn't very friendly from the beginning. She told me I needed to fill out paperwork, even though I had filled everything out online before the appointment. And, in that moment, I decided I wanted to do a 2D ultrasound instead of a 3D. And that just like made her really mad, right? Because I'd filled out a 3D online and she was all flustered about it. I was like, I changed my mind.
Oh my gosh. Like
And
even the people at the elective place aren't very
oh,
friendly.
just wait.
Oh no.
And Delaney wanted a stuffed animal. I because like any other place, right? They have those stuffed animals. You can put the heartbeat in it.
Mhm.
I said, okay, let's wait until the end, and then we can get one then. We go in the ultrasound room, which has the big bed. It has the big screen. The ultrasound technician goes over how she determines the gender at this point. Since I was just 14 weeks, I think I was 14 weeks and like 0 days. So I was kind of at the point where this is the first time they would even attempt to find the gender. She starts the ultrasound, and I see baby on the screen. I notice immediately that there is no movement, but it doesn't really click. I assumed he was just sleeping. She goes off to the side and starts writing something down, which I thought was weird. She then says I need to step away. I'm not sure what's going on in my head, but nothing had really clicked of what might be happening. She came back out and said, I can't find a heartbeat. I even called the local doc, and he doesn't see any cardiac activity either. You need to follow up with your OB on Monday. That was it. That's all she said. Not, I'm really sorry, but your baby seems to have passed. Like
Oh my
her
gosh.
bedside manner was also terrible. I don't
Yeah,
think I
you're
could,
just going through something traumatic and she's just
right.
like, well, sorry, follow up with your doctor. Next
Yeah,
person, please.
exactly. That's how it was. And I did notice the measurements, and the baby was measuring 14 weeks and 4 days. So he was measuring 4 days ahead of where I was in the pregnancy. So everything just seemed really strange. Like I was shocked. I was like, if something happened, it must have literally just happened. Told my husband, let's drop off the kids at the neighbors and go straight to the ER to see if this lady even knows what she's talking about. On our way out, Delaney was still begging me for that stuffed animal. I told my husband, just go ahead and buy it so we could leave. And the ultrasound technician made sure to let me know that it was a heartbeat animal and she couldn't put the heartbeat in it. I was
Oh
like,
my
yeah, I
God.
understand that.
This lady, what?
Yeah. And she charged me full price for the ultrasound, which is like, okay. But you're right. It was like, okay, on to the next person. Bye.
I
And
mean,
I'm
that
just
is so insensitive. I just can't, like, I don't know how you can be so callous towards somebody.
right. I told my husband when I was talking to him earlier today, I was like, I don't think we could have picked a worse person to tell us that our baby had passed. Like
Yeah.
literally.
Yeah. I'm sorry you had to find out that way
Yeah.
through that person.
Right. And she asked me if I wanted the pictures. And I was like, yes, I want the pictures. Like,
Yeah, like, why would I not want them? They're still
right,
my baby.
right. So we drove 1 hour to the neighbor's house and then we drove straight to the ER. The ladies in the ER, they were trying to comfort me. They were like, well, their equipment was probably bad. You look pregnant with your cute belly. Like, we'll find out what's going on. And I thought I was feeling kicks in the waiting room. So I was thinking this lady is just, she's not making any sense. My HCG came back at around 46,000. The ultrasound technician was very quiet, but I knew that that wasn't unusual. I know they're not supposed to tell you anything. But as I sat back down in the wheelchair to go back to the room, she just stood next to me and said, your doctor will need to come talk to you. I kind of knew at that point it wasn't going to be good news. I got the results on my phone before the doctor came in, and I read the words no fetal heart rate or fetal activity demonstrated consistent with fetal demise. And I just burst into tears, right? I don't think there's anybody in the world that could have possibly provided any comfort to me at that point.
Do you
But
think it was worse though finding out on your phone versus having somebody tell you, or do you think it was better?
I think it was better. I don't know. I think just having a moment to like, okay, this is what happened. And the doctor came in, and obviously there's nothing he could do, right? It was like, well, you're
Yeah.
just gonna have to follow up with your OB, like,
Yeah.
but it wasn't like I could just go home and relax because I had the two other kids. So we had to call my in-laws on the way back home. My mother-in-law was at work. She worked at a hospital as a nurse. She was like, I'm going to leave and I'm going to come get the kids. Don't even worry about it. So I was like, okay, thank you. So she got to my house at probably 11 at night. Like it was pretty late. And by this point, Delaney was 5 and Killian was 2. So when Delaney came back home from the neighbors, she started asking a lot of questions about her baby brother. I told her I needed her to go to Nana's for a few days and I needed to have the baby. She was like, "Oh, you're gonna have him early and bring him home." So it was like heartbreaking to try to explain to 5-year-old like what had
Yeah.
happened, and then she's asking a lot of questions. Well, why? Why did this happen? What happened? And it's like we don't know. So that was tough, and I will say like she took it hard actually for a 5-year-old, and even I'll continue on with my story, but I did have one final healthy pregnancy with my daughter Tegan that I just had 2 months ago. And right up until I delivered Tegan, Delaney was asking me, is the baby okay? So it's like
Oh.
they really think about these things like more than you think that they would.
Yeah, they definitely do. I think they understand way more than we ever give them credit for.
Yeah. Yeah. I think they do too. Okay, waiting until Monday morning was torture for my OB's office to open. I spent a lot of time Googling and trying to like research. I had a friend that had a late first trimester loss. I think she had lost a pregnancy at around 13 weeks. So I was texting with her and just kind of seeing what her experience was, like what options she had. And I had reached out to a couple other people I knew that had had either late first semester or trimester losses or second. And I was just trying to get in my head like what my options might be. So the OB wanted me to come in that afternoon, Monday afternoon, to confirm what the ER had found and discuss options. I wasn't expecting any better news. She started the ultrasound and it didn't last long. She put her hand on my leg and said, "I'm really sorry." I knew what that meant. She told me that because I was now in the second trimester, my options were to go to labor and delivery in the current hospital and be induced, or to have a D&E, but it would have to be scheduled in Morgantown, which is an hour and a half away. I didn't hesitate. I talked to enough people to confirm my decision that I wanted the D&E. I was induced with both of my children, and I didn't think I was emotionally strong enough to make it through an induction. I was trying to think of it as more of like a surgical procedure. That was kind of the only way I could, make myself move forward. My OB told me she would call Morgantown and get me in as soon as possible because this was right before Christmas. I don't even think I turned the car on before she had called and said she had arranged the D&E for 2 days later, December 18th. She told me I would need to go to Morgantown the next day to do some prep work and get cervical dilators inserted. Didn't really know what that meant, but I booked our hotel and we headed up to Morgantown the next morning. It was very painful to get these cervical dilators inserted. They gave me some sort of numbing gel, but it felt like it was doing nothing. I was crying and I was screaming about how awful the pain was. And they just kept saying, well, it can cause cramping, like you're reacting like how we see other people react. And I'm like, okay, is that supposed to make me feel better? Because this is terrible.
Oh, that sounds
Um,
awful.
yeah, and my husband and I went back to our hotel and I was just trying to rest and, get through it. I mean, it felt like contractions. That's what it felt like. And everyone I'd messaged about this procedure did not have the cervical dilators inserted. So I realized at that point that I was having a DNE and not a DNC. So all of my friends and everyone I had talked to that had a DNC had not had these cervical dilators inserted. So nobody knew what I was even talking about. We had to be at the hospital super early, like 5 a.m. They took me back to a room, but I learned that the surgery was going to be delayed because another procedure was taking longer than expected. And then a nurse came in and asked me if I wanted her to take handprints and footprints if she was able to. I told her I did. I also told the staff that I would like all genetic testing that could possibly be performed. Since the other miscarriages had happened early, we were never able to have any genetic testing done. Right as I was getting ready to get wheeled back for the D&E, I was scrolling Facebook. Everyone in my town was commenting on what a beautiful rainbow there was that morning. So it was like in that moment, I was like, okay, everything's going to be okay. Like this is terrible, but I think eventually I'm going to have my rainbow baby. The D&E went well. They were able to get the handprints and footprints, which obviously were really hard for me to look at. Like, I mean, to this day, like I can't look at them without just like bawling. But I am grateful to have them, obviously. And the recovery itself started out not being too terrible. I had some bleeding, but it wasn't, like I had given birth. It wasn't like that level of bleeding. By this time, it was about a week before Christmas, so I was trying to do everything I could do to get ready for Christmas since my two kids were very excited for Santa to arrive. During this time, I did a lot of journaling and I was trying to cope with these feelings that I was having. I also had several sweet friends and coworkers send us flowers and food. I will say all the flowers made my house smell like a funeral home, which was very, very triggering. And I would get these flowers delivered. I would get phone calls like, "Hey, so and so's, we're gonna be dropping off flowers." And it's like, "Well, thank you," but yeah, it just that was hard,
Yeah, lots of like mixed emotions around it all. Like thanks for being supportive, but also like it's just a reminder.
right? Yeah. I remember we put that stuffed animal that Delaney insisted that we buy from that ultrasound place in the garage. It was about a week after I had the D&E and I looked at it closer because I really hadn't looked at it. I just was like, let's buy it and leave. Well, I realized it was a bear with wings. So that was weird. Like out of all the stuffed animals they had in that place, she picked the one that would like represent an angel. And it was a super eerie feeling. And it wasn't anything I had noticed when she had picked up the stuffed animal. So it's like everything that day was like foreshadowed from the beginning. Like it was really kind of crazy. So it was Christmas Eve, and we had packed the kids up to head down to my parents' house, which is about an hour and a half away. Saw a result pop up on my phone. It was the genetic testing results of the baby. The results said normal male. We were in the Starbucks drive-through, and I just burst into tears, like started crying hysterically. I mean, the only thing that had gotten me through the past week was thinking that there must have been some genetic issue or disorder for this to happen, and there wasn't. So it took me a long time to come to terms that he was healthy, normal male, and I still lost him. Someone I had talked to that had a DNC had warned me that the bleeding seemed to increase around day 7 or 8. She was right. I remember the bleeding getting super intense Christmas Eve night. So the timing was terrible. I felt awful. I did make it through Christmas, but the weeks after that were still really hard. My husband had to go back to work. The daycare was closed until January for a break. So just me and my two kids at home. It was really hard to even get out of bed, let alone be a good mom during that time. At one point I'd reach back out to my mother-in-law and my parents, like, hey, can somebody come help me with the kids? And they just didn't get it. None of them have ever had a loss. So it was like, well, your procedure's over. Like, we watched the kids for a while. And it's like, you don't understand. Like, I can barely get myself out of bed, let alone like play with them. And like, so it was a rough time. And I just felt like nobody really understood what I was going through.
Yeah, and your kids don't understand that fully either. They're like, "Oh, why aren't you playing with me? Why aren't you
Right.
doing this?" And you're like, I can't."
Yeah.
Even though like I know you need me, it's just too hard to it's hard to grieve and be present at the same time.
Right. Yeah, it definitely is. And during this time, I actually started to regret having the D&E. I I still kind of feel that way. Like I never got a chance to hold him. I never got a chance to see him. It's like I don't have closure. It's been approximately 14 months since all of this happened, but I still go back and forth. Like in that moment, I think the D&E was the best decision for me, but it's it's just it's I don't know. I still feel like I just can't move on, right? Even though I have a healthy baby that has, since this has happened, but I almost wonder if I would have been induced if it would have been better or worse. I don't know.
And that's hard to know sometimes because then we're hit with all the what ifs and it's
Right.
hard to know. It could have been better, it could have been worse,
Yeah.
but not knowing is what I think keeps us kind of in that limbo.
Yeah. Yeah, I think so. So I had a follow-up appointment with my OB in mid-January. The nurse asked me if I'd like to be referred to a fertility doctor since I'd had three losses by that point. I was like, yes, finally.
Like, oh, okay, now you'll
Yeah,
finally listen to me.
right. So I met with the fertility doctor in Morgantown, and he had no idea what could have happened. I mean, they ran some tests. I had already had my thyroid tested after the second loss. There were some other tests they ran, and everything came back normal. Nothing was picked up. So I didn't really have a lot of hope that, I'd be able to have a healthy pregnancy again because we don't know what happened. And the other thing is they never, throughout all the testing that's been done on me and all the appointments I've had, they've never offered to test my husband ever. So I'm like, is it something on his side? I guess we'll never know.
Yeah, that's crazy. I mean, especially with a fertility doctor.
Yeah,
Like you
it
would
was
think that that would be like one of the first steps.
right. Yeah, but it was all on me. Everybody was focused on me and they said I was fine and they couldn't find anything wrong. So my husband and I decided we would take a break from trying. But in the back of my mind, I had heard that you're most fertile within the first 3 months of having a miscarriage. So in March of 2025, I took an ovulation test and it was positive right away. And I got pregnant again on the first cycle. I contacted the fertility doctor right away. He sent me to get my HCG drawn. The number came back around 5,000 at 4 weeks, which he said was great. I went back 2 days later and it was nearly 10,000. His office was happy with that. He told me to come in around 6 weeks. He did an ultrasound and everything looked good. He did tell me there was a small subchorionic hematoma. My heart sank because I was thinking, well, that's how the previous pregnancy started. Told me not to worry and I might not even have bleeding from it. I saw him twice more and he told me that I graduated and I should just go to my regular OB. I did ask for an extra scan at 14 weeks this time. My OB was willing to do that and she said everything looked great. My pregnancy with my daughter was pretty standard, except that the OB did send me to the MFM for like a detailed 20-week scan since I had the second trimester loss. And also by this point, I was 34 and I was going to be turning 35 5 days before the baby was due. So of course I got advanced maternal age tacked onto everything. And every time I
Ugh,
go to
I hate
appointments,
that.
they kept bringing it up. And I was like, listen, I'm 34. I'm barely going to be 35 by the time I have this baby. So
Yeah, I hate that label. I had that too because I was 35 with my last daughter that was born too. I'm like, will you stop reminding me that I'm old, please?
Right.
As if 35 is old, but
Yeah, really. The other thing I was going to share about this pregnancy is obviously it was hard. Like my anxiety was through the roof, and it wasn't like my pregnancy with my son, where after the first trimester, I kind of felt like things were okay. It was, I don't know that I felt everything was okay until I gave birth. Like I just kept thinking something bad was going to pop up. Even the day I was going to be induced, I kept thinking, okay, maybe something's going to be wrong. It's like, it's really hard to get those thoughts out of your head after what had just happened.
Yeah, I
But
think I didn't breathe until my rainbow was like put on my chest, and then
yeah,
I was like so shocked, like you're here, you're
yeah,
okay, like you're oh my gosh, yeah, it's
yeah,
terrifying.
yeah, same here. And the other thing about the pregnancy was it was confusing to Delaney and her friends. So Delaney had told her friends at school previously that I was pregnant with a boy, which was true. And once we learned this new pregnancy was a girl, some friends actually accused her of lying. And they were like, "You just told us you were having a baby brother." And she was like, "Well, I was, but he died." And I'm like, my 5-year-old is having to explain this to people?
Oh my gosh, yeah, like shouldn't even be put in that position. I mean, I know they're just kids, but it's like, come on.
Yeah. So that was rough. And I guess the other thing I forgot is after I had had the loss of my son, I had helped out with Delaney's Valentine's Day party. And I go in there and it's like me and two other moms that were helping with this party. And one of the moms I had never met, and she was just, kind of casually talking. And the question comes up, how many kids do you have? And it's like, how do you answer that? Right. Like, I had just lost my son and I had Delaney and Killian and didn't really know how to answer it. So that was tough. Like whenever questions like that come up, I never know how to respond. I've had 6 pregnancies, but I have 3 living kids.
Yeah, and I feel like you don't always want to go into it with everybody. Like you don't want to,
No,
relive it every time somebody asks you that question, but then part of you feels guilty for not including them. But like
right.
you're including them in your head.
Yeah,
Yeah,
right.
it's weird. You're like, how do I even, I don't know. Can we talk about something else?
Yeah, I know. That's right. I was gonna say to summarize, like my pregnancy with my daughter was fine. I was induced at 39 weeks and she's 10 weeks old now and she's great and I'm so thankful to have her. But there are some days where I previously I had envisioned my family being Delaney, Killian, and a boy, right? Well, now it's Delaney, Killian, and Tegan, a girl. So it's just like it's a weird feeling, to think of your family composition different than what what had been initially planned. So
Yeah. Yeah, that's definitely hard. I just feel like, along your whole journey here that you had so many people that were just dismissing you, not
yes,
listening to you. I mean, yeah, it's very frustrating that, I mean, even when it comes down to people thinking that we don't know our own bodies, like you knew when you ovulated, and people are like,
right,
"Are you sure?" Yeah, yeah, I'm sure,
right.
But it's just like, how did you, I guess, have you gotten better at advocating for yourself at all, like going through this?
I think so because I think starting out I just had trusted my OB, but yeah, I've tried to. And with my husband being in the medical field, it's both a blessing and a curse, right? Like sometimes he doesn't even want people to know that he's in the medical field when he comes to appointments with me. But yeah, I've tried to, and it's hard. It's hard when you try and they still don't listen. It's like, well, no, you need to wait till you have 3 losses. And it's the fact that we have no answers why anything has happened. It's crazy. And we're pretty settled that we're gonna stop now. Like 3 is it. But my husband has been like, well, maybe we should try for a fourth. And I'm like, I don't think I can. Like, I mean, I would love a fourth, but without knowing anything that's happened, I'd be afraid it would happen again. So
Yeah, that's the hard part about not having answers. I mean, because you had the losses at different points in the
yeah,
pregnancy too, so it's hard to know, was it the same thing that caused all of them? Was it? just I mean, I say random, but you know
Yeah.
what I mean. Like different things, I guess, that affected him. I mean, I don't know how I would feel about trying again either. I mean, we knew why we lost our daughter, and I still had a hard time trying again.
Yeah. Yeah, it's hard. Pregnancy after loss is really, really hard. And it's, I don't know, I had a few friends that had a miscarriage, but I still felt so alone. Like, because I didn't know anybody that had losses like I had had, especially with the pregnancies in between and just not knowing any reason why anything had happened. And, I know people see me post pictures of my kids on social media and they probably just assume, well, you know, you got 3 kids, but people don't realize I've been pregnant 6 times.
Yeah, I always try to remember in my head because, I don't know if it has for you, but after going through everything that we went through, even now that I have living kids, it's been almost 8 years since we lost Jasmine, and I still have a hard time around pregnant people sometimes
Hmm.
and around like baby showers and things like that.
Yeah,
And I have to constantly remind myself that like, okay, just because they're pregnant now doesn't mean it was an easy road for them.
right. That's true. And I remember people posting on social media that they were pregnant like right around the time I lost my son. I was like, I just have to just delete Facebook. I can't look at people announcing pregnancies.
It's hard. I mean, and then people make you feel guilty about it. Like you're the one doing something wrong. And it's like, don't you understand what I went through?
Yeah.
Like I lost my babies. I
Yeah,
don't
and
I don't know why people can't understand that.
I know. And it was hard because both times I had very good friends that were pregnant and their pregnancies were fine. And I'm over here like grieving, trying to figure out what's going on. And their belly is getting bigger. And so I found myself like really struggling, like trying to be really happy for them, but like, really sad for myself.
Yeah, there's definitely a lot of like conflicting feelings that come after it. And then I feel like, people say, well, if you're not happy I mean, and you are happy for them, but it's
Yeah.
okay to also be sad for you. Like you said, like it's okay. You don't have to be 100% happy all the time and push your feelings aside,
Yeah. Yeah.
despite what other people think. Yeah, so do you have any advice for, somebody who is going through recurrent loss or, thinking about trying again after multiple losses?
I think just try to advocate for yourself, even when your doctor doesn't listen. Looking back, I probably should have tried to find another doctor, but I don't know that I would have had any better results. It seems like a lot of people I've talked to or podcasts I've listened to, offices don't want to do any testing until you've had 3 miscarriages. I mean, occasionally you might find somebody that'll do them after you've had two, but it's just, yeah, it's kind of a hard spot to be in. But yeah, definitely do your research, advocate for yourself, and talk to people. That's the only thing that got me through this was finding people that had similar experiences, at least somewhat. I know I said I felt alone, which I did, but like just even anybody that had a DNC that I knew, I was just talking to them and they were giving me advice. And yeah, I think that's the best thing is just to try to find some comfort somewhere. It's hard though.
Yeah. Well, is there anything else that you want to share or add before we wrap up?
No, no, I think I covered everything I needed to. And thank you so much for having me on. Like I found your podcast fairly recently and I wish I would have found it sooner because listening to podcasts really did help me during this time, just knowing that there were other people having these losses and I'd listened to some other podcasts before, but yeah, I'm very happy I found yours now.
Yeah, I always find it helpful to listen to other stories too and just know, like you said, that we're not the only one going through it, that there's other people that understand, that there's other people that have been able to have babies, that, I mean, just all of those things I find helpful too.
Yeah.
Yeah, so thank you so much for coming on and sharing your story today.
Yes, thank you. Thank you for having me.
Thank you so much, Goldie, for sharing your story with us. If today's episode resonated with you, I just want to say if you've ever been dismissed, minimized, or made to feel like your loss didn't matter, please know that it does matter. And your grief is real and your experience is real. And don't be afraid to ask the doctor, is there any reason why we shouldn't look into this further? It can open the door to more information, more clarity, and sometimes better care. And if something still doesn't feel right, it's okay to switch doctors or ask for another opinion. You deserve to feel heard in your own body and your own experience. If this conversation meant something to you, please consider sharing it with someone who might need it, or leave a review on Apple or Spotify. It really helps more people navigating infertility and loss to find the show. Thank you so much for tuning in, and remember, we are all in this together.